Hey everyone, welcome back. Ready for another deep dive.
Absolutely. Always ready to explore.
Awesome. Today, we're tackling a topic that's, well, kind of close to home, Pregnancy lab tests.
Ah, yes. The fascinating world of pregnancy labs.
We've got this super informative medical text on pregnancy labs, and our mission today is to break it down, make it clear what each test is for, why it's important, and hopefully help you feel more prepared and confident if you're ever in that situation.
I think that's a fantastic goal. Knowledge is power, especially when it comes to something as important as pregnancy.
Right. Imagine you or your partner are expecting. Suddenly, these tests become like this window into what's going on, helping ensure a healthy pregnancy. I'm really excited to learn more about this, and hopefully our listeners are too.
Me too. Let's dive in.
Okay, so this medical text breaks down pregnancy lab tests into three main categories: blood tests, urine tests, and genetic screening. Let's start with blood tests. What are some of the essential blood tests performed during pregnancy,
Mm.
and what kind of information do they give us?
Well, first up, we have the complete blood count, or CBC.
CBC, okay. Heard of that one. What's it all about?
It's basically a checkup for your blood. It looks at all the different components, including your red blood cells. And that's especially important during pregnancy.
Why is that?
Because red blood cells are the ones carrying oxygen to, well, everywhere. The mom and, of course, the developing baby.
Makes sense, yeah.
Yeah.
Everything needs oxygen. So what if the red blood cell count is low? Is that a problem?
Yeah, that's what we call anemia, and it's actually pretty common during pregnancy.
Really? Why is that?
Well, your body's working overtime, creating more blood to support the baby. So sometimes it can't quite keep up with the demand for red blood cells.
Wow, that's a lot of work for the body to handle. So what happens if anemia isn't treated?
It can lead to fatigue and weakness for the mom, for sure. But it can also affect the baby, slow down their growth, increase the risk of premature birth. So it's important to catch it early.
Yeah, that makes sense. Early detection is key, right? Okay, so we've got the CBC, checking our red blood cells. What else is on the blood test list?
Next up is blood type and Rh factor.
Ah, yeah, I've heard of that, but I don't really remember what it's all about. Can you refresh my memory?
Sure, it's basically a compatibility check between the mom's blood and the baby's blood. Specifically, we're looking at the Rh factor.
RH factor. Okay. So, like, what if they're not compatible? What happens then?
Well, if the mom is Rh negative and the baby inherits Rh positive blood from the father, it can create a bit of a conflict.
A conflict? Like, what kind of conflict?
The mom's immune system might see the baby's Rh positive blood as like a foreign invader and start producing antibodies to fight it off.
Oh, that doesn't sound good. Can those antibodies hurt the baby?
They can, yeah. They can cross the placenta and attack the baby's red blood cells. This can lead to a condition called hemolytic disease of the newborn.
Hemolytic disease. That sounds serious.
It can be, yeah. It can cause anemia, jaundice, and in more severe cases, even brain damage or heart problems in the baby.
Oh, wow. That's pretty scary. So, what can be done about it?
Thankfully, we have a treatment called Rh immunoglobulin. It basically prevents the mom's immune system from producing those harmful antibodies.
So that's good. So it's like a preventative measure.
Exactly. It's usually given during pregnancy and then again shortly after delivery if the baby is Rh positive.
Okay, so that's a huge relief. Science to the rescue. We've covered CBC, blood type, and RH factor. What else do we need to know about blood tests during pregnancy?
Another important one is the glucose screening test. It's typically done between 24 and 28 weeks.
So like halfway through the pregnancy?
Yeah, around that time. It's checking for gestational diabetes.
Gestational diabetes. I've heard of that, but I'm not totally sure what it is.
It's a type of diabetes that develops during pregnancy. And high blood sugar can cause problems for both mom and baby.
Right, so it's like a mid-pregnancy checkup to make sure everything's running smoothly. Okay, and then I think our medical text also mentioned a rubella immunity test. What's that all about?
Rubella, also known as German measles, can be really dangerous if a pregnant woman gets infected. It can cause serious birth defects. So this test checks whether the mom has immunity to rubella.
So if she's immune, she's protected.
Exactly. And if not, then precautions can be taken to prevent infection.
Got it. Wow, so many important things to check with these blood tests. It's amazing how much information we can get from just a small sample of blood. But we're not done yet, right? We also have urine tests to talk about.
Yes, urine tests are a regular part of prenatal care.
Okay, so why are urine tests important during pregnancy? What do they tell us?
They can reveal a lot about the mom's health and how the pregnancy is progressing. They're quick, painless, and offer valuable insights.
So what exactly are doctors looking for in these urine tests?
One thing we look for is protein in the urine. High levels of protein, especially later in pregnancy, can be a sign of preeclampsia.
Preeclampsia. That sounds a little scary. What is it exactly?
It's a serious condition that involves high blood pressure, and it can affect different organs, like the kidneys.
And that's bad for the baby too, right?
Right, it can restrict the baby's growth and sometimes lead to preterm birth.
So what happens if a urine test shows high protein?
Then we do further tests to confirm preeclampsia, like monitoring blood pressure and checking kidney function.
Okay, so early detection is key here too. Now, we talked about gestational diabetes earlier. Are urine tests used for that as well?
They can be, yes, they can detect glucose in the urine, which can be a sign of gestational diabetes.
Ah, so it's like another piece of the puzzle when it comes to managing blood sugar during pregnancy.
Exactly.
Okay, are there any other things that urine tests are used for during pregnancy?
One more thing. They can also detect urinary tract infections or UTIs.
UTIs. Aren't those pretty common anyway?
They are, but they can be even more common during pregnancy due to hormonal changes.
Ah, okay. And I'm guessing it's important to treat them quickly.
Absolutely. Untreated UTIs can lead to complications, so it's best to catch them early and treat them effectively.
So blood tests and urine tests, they're like these regular checkups throughout the pregnancy, making sure everything is okay. But we got one more category to cover, genetic screening. This one sounds a little futuristic.
It is pretty amazing. Genetic screening allows us to assess the risk of a baby having certain genetic conditions.
So like conditions that are passed down through genes.
Right, things like Down syndrome or other chromosomal abnormalities.
So these tests don't give a definite diagnosis, right? It's more about assessing the risk.
Exactly. It's about providing information and helping parents make informed decisions.
That makes sense. So what kinds of genetic screening tests are available?
One common one is the first trimester screening, which involves a blood test and an ultrasound.
Ah, so they look at both things together. What are they looking for in the ultrasound?
They measure the thickness of the fluid buildup at the back of the baby's neck. It's called neutral translucency.
Neutral translucency. Okay. And what does that tell us?
An increased thickness can be associated with Down syndrome and some other conditions. But it's important to remember it's just one piece of the puzzle.
Right, it's combined with the blood test results, right?
Exactly. And the mom's age, too. All of those factors together help determine the risk.
Got it. Are there any other types of genetic screening besides the first trimester one?
Yes, there's also non-invasive prenatal testing, or NIPT.
NIPT, okay. What's that like?
It's a blood test that analyzes fragments of fetal DNA that are circulating in the mom's blood.
Wait, so they can get the baby's DNA from the mom's blood?
Yep. Pretty cool, huh?
That's incredible. And what kind of information can they get from that?
It can screen for Down syndrome and a few other genetic conditions with a high level of accuracy.
Wow, that's really amazing. Science is incredible. Okay, so we've covered blood tests, urine tests, genetic screening. I think there's just one more area to touch on, right? Infectious disease screening.
Yes, that's an important one.
So why is it so important to screen for infectious diseases during pregnancy?
Well, some infections can be passed from the mother to the baby during pregnancy or childbirth, and those infections can sometimes cause serious problems for the baby. So screening helps us identify any potential risks and take steps to protect the baby.
So it's all about preventing transmission and keeping the baby safe.
Exactly.
Okay, so what are some of the infections that are usually screened for during pregnancy?
HIV is definitely one of the most important ones. Early detection and treatment can significantly reduce the risk of transmission to the baby. We also routinely screen for hepatitis B and C, syphilis, and sometimes other sexually transmitted infections depending on the individual situation.
Got it. So it's like a comprehensive check to make sure both mom and baby are protected.
Right. It's all about taking proactive steps to ensure a healthy pregnancy.
This has been such an informative deep dive. We've learned so much about all these different lab tests, blood tests, urine tests, genetic screening, infectious disease screening. It's amazing how they all work together to paint a picture of the pregnancy and ensure the health of both mom and baby. So I'm curious, is there a specific schedule for when these tests are done?
There's a general timeline, yeah. Certain tests are typically done in the first trimester, others in the second, and so on. But it's not a one-size-fits-all kind of thing.
So it can vary from person to person.
Exactly. It depends on a lot of factors. The mom's medical history, family history, any existing health conditions, and of course, every pregnancy is unique.
Right. So it's important to talk to your doctor about what's best for you.
Absolutely. Communication is key.
I totally agree. This deep dive has really opened my eyes to the world of pregnancy lab tests. It's incredible how much we can learn from these tests and how they can help expectant parents feel more informed and confident throughout their journey.
I couldn't agree more. It's all about empowering parents with knowledge and helping them make the best decisions for themselves and their babies.
Well said. To all our listeners out there, thank you for joining us on this deep dive into pregnancy lab tests. We hope you found it informative and helpful. And remember, if you have any questions or concerns, always talk to your healthcare provider.
Absolutely. They're your best resource for personalized advice and guidance.
Until next time, stay curious and keep exploring the fascinating world of knowledge. See you next time.
You've been listening to the Learning Podcast, a production of metaNESTA. Remember, learning is a journey, one step, one insight, one skill at a time. We'll see you next time. Keep learning, stay curious, and as always, be awesome.